Good morning, students.
Good morning,
Good
ma'am.
morning, ma'am.
Okay.
Good morning, ma'am.
So today there was one class that is on Ajayga's venous system, but you have already taught about that with the thoracic wall. I think Dr. Bishwajit has already told about that Ajayga's venous system, isn't it? Okay. So therefore, I will take this class today. That is the development of aortic arches. Now, aortic arches means these are there are some arches which are developed between the ventral aorta and the dorsal aorta. Now, the ventral aorta, that is the part of the heart tube, that is the most cranial part of the heart tube, that is known as the truncus arteriosus, and that is the most distal part of this truncus arteriosus is dilated and form the aortic sac. And from that aortic sac, all the arches are formed. And the dorsal aorta is formed on the dorsal aspect of the body, and there are two dorsal aorta initially, and in the that is in the cranial region, but that is in the cervical and in the cephalic region, that there are two aortic arches, but ultimately at the level of the T4, these two dorsal aorti, they join together and they form a single dorsal aorta. Aortic sac, that forms the ventral aorta. Okay, aortic sac that forms the ventral aorta, and the ventral aorta is connected with the dorsal aorta with some aortic arches, with some vessels which connect the ventral aorta and the dorsal aorta. Now, before going to these structures, I should tell about the how the blood vessels are developed. Now, the blood vessels are all developed from the mesoderm. From the mesoderm, by third week of life, the blood vessels will be developed from the mesoderm, and the some mesodermal cells, by they secrete some factor that is known as the vascular endothelial growth factor, and by their own secretions, these cells are converted into angioblast, that is the blood forming cells they form, and that hemangioblast, they are known as the hemangioblast, and that hemangioblast, they form the lacunae, they form the blood islands, they form the blood islands from where the blood lacunae are formed, and there are the hemangioblasts are present in this blood lacunae. So where they will first appear, they will first appear in the mesoderm surrounding the yolk sac, but later on they will also appear in the lateral plate mesoderm, and from there these blood islands, they form the various vessels. So I will show you how they are formed. Suppose these are the mesenchymal cells, and they secrete the vascular endothelial growth factor, and that will differentiate the mesenchymal cells. They will be differentiated into hemangioblasts, and the hemangioblast ultimately they will form the blood islands. Now these blood islands, there are hemangioblasts that's present, but some cells are present inside the blood island, that is known as the hematopoietic stem cells. That is from that hematopoietic stem cells, all the blood, that is the corpuscles, blood corpuscles are formed. That is known as the hematopoietic stem cells. From the stem cells, all blood corpuscles are formed. And some cells are at the periphery, and they are known as the angioblast. And that angioblast is also induced by the vascular endothelial growth factor to form the lining of the blood vessels. Okay. So that lining of the blood vessels is formed by the angioblast. Ultimately, this lining, that endothelial lining, they fuse with each other and they form a plexus that is known as the primary vascular plexus. And from that primary vascular plexus, the dorsal aorta, the common cardinal vein, the anterior cardinal vein, the posterior cardinal vein, all you know that they are developed from the blood plexus, okay, from the primary vascular plexus. This process is known as vasculogenesis. Now, there is another process that is known as the angiogenesis. Now, from this blood vascular process, the other blood vessels are formed by two methods. One, either by the sprouting method or by the angiogenesis into susceptive angiogenesis. In the sprouting method, there will be a tip cell, that is the leading cell, and that cell will come out from that vessels and other endothelial cells will follow it. So that is the tip cells that is followed by the other endothelial cells, and another new vessel is formed. Now there is another type by which there is a septum is formed. There is a groove, and then these grooves, they are joined with each other, they form a septum, and ultimately from one vessels other vessels are formed. Double vessel is formed here. So that is the angiogenesis. So other blood vessels, they are developed by angiogenesis. Now we know the heart tube, that is, this is the heart tube. There is a venous end and there is an arterial end, and the arterial end will form that ventricle, and then that bulbus cordis, truncus arteriosus, all these things. And at the distal part of the truncus arteriosus, there is the aortic sac, and that will form the ventral aorta. This aortic sac, it divides into two horn, right horn and the left horn. The right horn and left horn, they are known as that is horn, and they are the part of the ventral aorta. So aortic sac and its two horn, they are the part of the ventral aorta. They are two horns, and these two horns are connected with the aortic arches. These are the curved vessels, and they connect the aortic arches. Now they connect the aortic arches, connect the ventral aorta with the dorsal aorta. The dorsal aorta in the cranial part, in the region where these pharyngeal arches are formed, in this region they are double. But below that caudally, that is at the level of the T4 level, they will join with each other and they form the single dorsal aorta. Now in this region the neck is formed. This is the head fold, this is the head fold, and this is the pericardial swelling. In between them the neck will be formed. This region is the buccopharyngeal membrane. From there the pharynx will start, and surrounding the pharynx, there are some mesodermal bar will appear. This mesodermal bar are known as the pharyngeal arches, and this arch artery, they will enter into the pharyngeal arches. So there are 6 pharyngeal arches. So there are 6 pharyngeal arterial arch also are present. Now this 5th pharyngeal arch, it is very transitory and it disappears soon. So that's why that 5th arterial arch also it is not present. If it appears, it disappears very soon. So there are only 5 pharyngeal arches are present, and they are named as the first pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch, and the 6th pharyngeal arch. So similarly, the arterial arch, the aortic arch, they are also the first arch artery, second arch artery, third arch artery, fourth arch artery, and the 6th arch artery. But not all these arch artery, they appear simultaneously. Okay, when the first arch artery starts to disappear, the 6th arch artery will appear. Okay, when the first and second arch artery, they usually disappear, only a remnant of that may be present, and then the 6th arch artery will appear. So here we can see that the pharyngeal arches, these are the mesodermal bar. These are the mesodermal bar. This is the head, that is embryo is folded, that is the cranial folding. So the forebrain comes forwards, and this is the pericardial swelling, and in between them the pharyngeal arches will appear. They appear on the ventral wall of the pharynx as well as on the lateral wall. So they are C-shaped mesodermal bar. They are C-shaped mesodermal bar present on the ventral aspect as well as on the lateral aspect. On the dorsal aspect, there will be no pharyngeal arches are present. So if we see it from the posterior aspect, then we can see the interior of the pharynx, and there are and on the anterior aspect there are the mesodermal bars are present. So these are the mesodermal bars, and from these mesodermal bars, these are known as the pharyngeal arches. From these mesodermal bars, the muscles, cartilage, bones, these are developed from this mesoderm. And these structures are supplied by the nerves and the blood vessels, and that nerves and blood vessels are particular for each pharyngeal arch. So the first arch artery will supply the structures of the first pharyngeal arch, the second arch artery will supply like that. So there are first arch, this is the second arch, this is the third arch, this is the fourth arch. The sixth arch is developed on the dorsal aspect of the aortic sac, which forms the pulmonary trunk. Okay, now we come to the arch. So here we can see that these are the arterial arches. Now here you can, that is the heart tube, this is the single heart tube, and that is here the truncus arteriosus. The distal part of it is known as the aortic sac, which is divided into right horn and the left horn, and this is dorsal aorta. So this is the heart tube, and this is the aortic sac, which divides into the right horn and the left horn, and this is dorsal aorta. Now the right horn is connected to the dorsal aorta by the arch. So this is known as the first aortic arch. Later on, from that the first aortic arch is formed, then the other aortic arches will also be formed. That is the second aortic arch, third aortic arch, fourth aortic arch, and the sixth aortic arch. So all of them, they will be formed. And now from this aortic sac, from the right horn of the aortic sac, this is the right horn of the aortic sac. From this right horn of the aortic sac, the brachiocephalic trunk, you know, that is the first branch of the aortic arch of the aorta in adult, that will be formed from the right horn of the aortic sac. Whereas rest part of the aortic sac and the left horn, that will form the part of the arch of the aorta, that is the proximal part of the arch of the aorta. So first part of that is ascending aorta, and after that the proximal part of the arch of the aorta is formed by the aortic sac and also by the left horn. Then there will be other arches will appear. Now I have told you that the first aortic arch and the second aortic arch, they appear by about 27th day and they disappear by about 29th day. So no such arteries are present, but they say that the part of the maxillary artery may be contributed by the first arch artery, and there are the two other arteries like the hyoid artery and the stapedial artery. They are the branches, they are the remnants of the second arch artery. So the first arch artery give rise to the part of the maxillary artery, and the second arch artery may also give rise to the hyoid artery and the stapedial artery. But the third arch, fourth arch and sixth arch, they are very large and they give rise to the arteries. Now here you can see the arches. So first arch artery will disappear, the second arch artery will also disappear, and the third, fourth and sixth arch arteries, they are dilated and they form the definite vessels. Now here also you can see that this ventral aorta and the dorsal aorta are connected by these arch arteries. So it is a symmetrical pattern, but during development, as this first arch artery and second arch artery disappears, similarly some other parts of this arterial arch area that will disappear, then there will be an asymmetrical pattern. So initially it was symmetrical, but later on it becomes asymmetrical. So we will come to that later on. And this dorsal aorta, it gives rise to the segmental arteries also. And it also gives 7 segmental arteries. Dorsal aorta gives 7 segmental arteries. So first segmental, second segmentals, and the 7th segmental arteries. And the dorsal aorta, they are double in the region of the pharynx, but at the level of the below the level of the T4, that is the fourth thoracic segment, they join with each other and they form the single dorsal aorta. In this picture that is taken from the Langman, you can see that the first arch is obliterated. The second arch will also be obliterated, but they have not seen that one. The third aortic arch is larger. The fourth aortic arch is also developing. And the sixth aortic arch will be developed from the dorsal part of the aortic arch because of the pulmonary septum will be formed, aorticopulmonary septum, So the sixth arch is connected to the pulmonary trunk, and from that sixth arch, the pulmonary arteries they appear. Before the sixth arch will appear, they can be seen. They are coming from the dorsal part of the aortic arch, which will later form the sixth aortic arch. Now here you can see that the first arch and second arch that is not shown, or they are present just as the maxillary artery, or the second arch as the hyoid and the stapedial artery. This is the third arch. This is the fourth arch, and this is the sixth arch, which is attached to the dorsal part of the aortic sac. That is because the aortic sac is divided by the pulmonary aorticoseptum, by the aorta and the pulmonary trunk dorsally. So this is the sixth aortic arch. And from the sixth aortic arch, the pulmonary arteries they grow towards the developing lung bud. Okay, and this is the dorsal aorta, which joins together to form a single dorsal aorta. After this, there are some other parts also disappear. The part between the third arch and the fourth arch is known as the carotid duct, and this part will be disappeared. So third arch, between the third arch and fourth arch, the part of the dorsal aorta is known as the carotid duct, and that part will be obliterated very soon. So third arch and the fourth arch, they are separated from each other. In between them, there is no dorsal aorta. The dorsal aorta part between the third and fourth arch. Now third arch is known as the carotid arch because it forms the internal carotid artery. So this is the third arch which connects the ventral aorta and the dorsal aorta. The third arch connects the ventral aorta and the dorsal aorta. Its proximal part will form the common carotid artery. Its proximal part will form the common carotid artery, and its distal part that will form part of the internal carotid artery. That will form that is the proximal part of the internal carotid artery. The rest of the internal carotid artery, it is formed by the cranial part of the dorsal aorta, and this is the internal carotid artery, and this is the external carotid artery. The external carotid artery, it is the continuation of the ventral aorta, or you can say the continuation of the horn of the ventral aorta, the ventral horn and the dorsal horn. Okay, so the third arch will form the common carotid artery and the part of the internal carotid artery. The rest of the internal carotid artery is formed by the dorsal aorta, cranial part of the dorsal aorta. Whereas the ventral aorta is also extended cranially. The ventral aorta, the horn of the ventral aorta, they will also extended cranially, and that will form the external carotid artery. External carotid artery. Okay. So you know that how this common carotid artery, internal carotid artery and the external carotid arteries are formed. Then come to the fourth arch. What happens to the fourth arch? Now the fourth arch is connected here to the horn of the ventral aorta, and that part that is the right horn, that will form the brachiocephalic trunk. Brachiocephalic trunk. And the rest of the fourth arch will form the proximal part of the right subclavian artery. Proximal part of the right subclavian artery. And it is also connected to the third arch, which forms the common carotid artery. So this is the brachiocephalic trunk in adult, which branches out into the right subclavian artery and the right common carotid artery. So that right horn of the dorsal aorta, that will form the brachiocephalic trunk, and rest of the common carotid artery, that is formed by the seventh cervical intersegmental artery. The dorsal aorta also gives the other segmental artery above the seventh cervical artery. These six intersegmental artery, they fuse together to form the vertebral artery. Vertebral artery, you will see later the vertebral artery, which is present in the neck. Okay, so this is the right that is the right subclavian artery. The distal part of the subclavian artery is formed by the seventh intersegmental artery. Whereas in case of this left side, the left horn of the aortic sac and the aortic sac itself, they will form the ascending aorta and the part of the arch of the aorta. Then the fourth aortic arch up to the connection with the seventh intersegmental artery, that will form the arch of the rest of the arch of the aorta. So the arch of the aorta is formed by the aortic sac, its left horn, and by the fourth aortic arch up to the attachment of the subclavian, that is the seventh intersegmental artery. That seventh intersegmental artery is actually fixed to the limb bud. It is fixed to the limb bud. So seventh intersegmental artery will form the subclavian artery. And here also the carotid duct, that is the portion of the dorsal aorta between the third arch and the fourth arch, is obliterated. Okay, so aortic arch is formed. Fifth arch is obliterated very soon, and the sixth arch is it is by the aorticopulmonary septum. It forms the aortic sac is divided into aorta and the pulmonary trunk. So the sixth aortic sac will be formed by the pulmonary trunk. That is, the aortic sac will form the pulmonary trunk, and which is connected to the dorsal aorta. The pulmonary trunk is connected to the dorsal aorta by the sixth aortic arch. On the right side, the proximal part of the sixth aortic arch persists, and it will form the right pulmonary artery, whereas the distal part that will be obliterated. That will be obliterated and that will disappear. On the left side, the proximal part persists as the left pulmonary artery, but the distal part also persists. The distal part is not obliterated, and it will connect the dorsal aorta, and that connection with the left pulmonary artery with the dorsal aorta, it is known as the ductus arteriosus. And here you can see on the right side, from the origin of the seventh intersegmental artery to its union to the left-sided dorsal aorta, that part is also obliterated. But on the left side, it will not be obliterated, and it will form the descending thoracic aorta. Descending thoracic aorta. And below the diaphragm, that will also form the abdominal aorta. So that is the aortic arches, the vessels which are derived from the aortic arches by this way. Now here you can see that the dorsal aorta also gives the intersegmental arteries. The intersegmental arteries. This is the first cervical intersegmental artery. Above that, that is the cranial artery. There are so many arteries are there. Hypoglossal here they have shown. So this is the first intersegmental, second, third, fourth, fifth, sixth and seventh. Now the first sixth intersegmental artery on both sides, they will fuse with each other and they form the vertebral artery and also few other arteries of the neck. And the seventh intersegmental artery, it is fixed to the limb bud and it forms the subclavian artery. The left side, on left side, the subclavian artery is totally formed by the seventh cervical intersegmental artery. But on the right side, it is formed by the first part of the subclavian artery is formed by the fourth aortic arch and then by the seventh intersegmental artery. The rest of the right subclavian artery is formed by the right seventh intersegmental artery. Now, the heart, which is present in the more cranial region in the fetus, gradually it comes down because of their head fold and because of that elongation of the neck, because of the appearance of the pharyngeal arches, it will come down. The heart will come down. As a result of that, the carotid arteries and the brachiocephalic trunk, they will be elongated. They will be elongated. They are going to the neck, but they are coming from the aortic sac. That means they are attached to the aorta, the heart, and because of this elongation of the neck, they are also elongated. And that time, The some cranial nerves are also they are crossing these arterial arches, and one of them is the vagus nerve. Another here they have shown that is the glossopharyngeal nerve. Now the vagus nerve, it gives the branches to all the most of the organs in our body. So it gives a branch to the pharynx, it gives branch to the larynx. Now one of its laryngeal branch, that is the inferior laryngeal branch, because of this elongation of the neck and because of this what is that elongation of the carotid arteries and the arterial arches also come down. One of the laryngeal branch, it comes out from the vagus nerve at a lower level, and then but it has to go to the larynx, so it has to go upwards again. So that's why it is known as the recurrent laryngeal nerve. It is actually the inferior laryngeal nerve, but as it goes again upwards to supply the larynx, it is known as the recurrent laryngeal nerve. Now to go to the larynx, this recurrent laryngeal nerve on both sides, they have to hook the sixth aortic arch. Here also they should hook the sixth aortic arch and they will go to the larynx. But later on, when that fifth arch will disappear and the right sided of the sixth arch will disappear, then the recurrent laryngeal nerve will hook round the, on the right side, it hook rounds the fourth aortic arch. That forms the right subclavian artery. I will come to that next picture. And on the left side, the recurrent laryngeal nerve will hook the ductus arteriosus. It will hook the ductus arteriosus. Okay. Now, here we can see that it is taken from the Langman. Now, this is the right vagus nerve. Here, because of this disappearance of the fifth arch and the sixth arch, distal part of the sixth arch, the recurrent laryngeal nerve hooks around the fourth arch, which forms the right subclavian artery. So, on the right side, it hooks the right subclavian artery. But on the left side, it will hook the fourth, that is the sixth arch, that will form the ductus arteriosus. And later on in adult, this ductus arteriosus, not in the adult, by about 3 months, this ductus arteriosus is obliterated and it is known as the ligamentum arteriosum. So it will hook round the ligamentum arteriosum. If the ligamentum arteriosum disappears, then you can see that the left recurrent laryngeal nerve hooks around the arch of the aorta. That is the left fourth aortic arch that will form. So it will hook around the left fourth aortic arch, and that will form the arch of the aorta. So on the right side, the right recurrent laryngeal nerve hooks the right subclavian artery, but on the left side it hooks around the aorta, or when there is the ligamentum arteriosum is present, it will hook the ligamentum arteriosum and then they will go towards the larynx. Okay. Now we can just summarize it. So right horn of the aortic sac, that will form the brachiocephalic trunk. The left horn of the aortic sac and the aortic sac itself, that will form the ascending aorta and the proximal part of the arch of the aorta. Then from the first aortic arch, by 29th day, both the first and second aortic arch, they will disappear. By 29th day of intrauterine life, both of them will disappear and only they persist as maxillary artery and the second arch as stapedial and hyoid artery. Third arch is very important because it is known as the carotid arch, because it forms all the carotid arteries, that is the common carotid artery and the proximal part of the internal carotid artery. And the external carotid artery, it is developed from the ventral aorta, that is from the ventral aorta, this that is the external carotid artery will be developed. Then come to the fourth arch. The fourth arch is also important. On the right side, it will form the proximal portion of the right subclavian artery, and on the left side, it will form the distal part of the aortic arch, or the middle and distal part of the aortic arch. Fifth arch, it disappears very soon, so it cannot be seen. And the sixth arch, that will form the right and left pulmonary artery, and distal part of the right side will disappear, but the distal part of the left side will be there, and that will form the ductus arteriosus. Later on, just after birth, there will be contraction of this ductus arteriosus occurs, and the blood cannot pass through the ductus arteriosus, and they cannot connect the aorta and the pulmonary trunk. And then after that, after 3 months, there will be intimal proliferation, and then there will be fibrosis, and it will disappear. That is the ligamentum arteriosum. Okay. Now, some clinical part. So, if the ductus arteriosus, it remains patent, that condition is known as the patent ductus arteriosus. In that case, as the aorta, it has a high pressure, the high pressure blood from the aorta will come to the pulmonary arteries, and then they will go to the lung. So there will be the pulmonary arteries pressure will be increased, and there will be more amount of blood in the lung. So there will be congestion in the lung, and more amount of blood will come out from the pulmonary artery into the right atrium and into the right ventricle. So they have to pump more. The heart will pump more to expel that blood to the aorta. So there will be cardiac failure, left heart failure may occur in this patent ductus arteriosus if it is present. Okay, these are very rare condition, but patent ductus arteriosus, its incidence maybe 1 in 10,000 like that, 1 or 8 in 10,000. Now another condition is known as the coarctation of the aorta, that is the narrowing of the aorta. So where the aorta will be narrowed, that is distal to the left subclavian artery. Distal to the left subclavian artery near the ductus arteriosus, it will be narrowed. And it usually when there is contraction, this contraction may be in that part of the aorta also. So that's why there will be narrowing of the aorta. There are 3 types. One is if it is cranial to the ductus arteriosus, then it is known as preductal. If it is at the level of this ductus arteriosus, then it is known as the paraductal or ductal, and another is the postductal. The postductal is the commonest type. The postductal is the commonest type of coarctation of the aorta, of these anomalies. So they are present, they are considered as the congenital anomaly. Now in that cases, the subclavian artery is not affected. So subclavian arteries, they are supplying the right limbs and the left upper limb. So if you take the pressure on the right and left upper limb, that pressure will be normal or maybe slightly high. But in case, but in the descending aorta, this blood cannot go. So in the left limb, in the left lower limb and in the right lower limb, there will be less amount, that is, there will be less pressure in these arteries. So the blood pressure will be low in the lower limbs, but the blood pressure will be high in the upper limb. And because of this coarctation of the aorta, the lower limbs, they also get their supply by the collateral circulations. So in these collateral circulations, the arteries which are connected with the aorta, they will be enlarged, like the posterior intercostal artery, internal thoracic artery. So they are connecting the subclavian arteries and the descending aorta. So they will bypass to these segmental arteries, and they will be enlarged. So when they will be enlarged, they are close to the ribs. So that's why they will give the anterior, that is the internal mammary artery or the internal thoracic artery, that gives the anterior intercostal arteries, whereas the descending thoracic artery, that gives the posterior intercostal arteries, and the subclavian arteries, there is a connection with the subclavian arteries also. So these arteries, from that subclavian artery, the blood will go into these arteries. Okay, the internal mammary artery is also a branch of the subclavian artery. So blood will go into those arteries and they will be enlarged. and because of this enlargement, they are close to the ribs, so they will cause notching of the ribs. So there will be notching of the ribs. So here you can see that in case of coarctation of aorta, there will be high blood pressure in the upper limb and low blood pressure beyond the point of coarctation, that is in the lower limb. Lower limb you will get the low blood pressure and high blood pressure there. And because of this collateral circulation, the other arteries, that is the posterior intercostal arteries and the anterior intercostal arteries, they will be engorged, and they will cause depressions in the ribs, and that is known as notching of ribs. Okay, now the other abnormal condition, like if the right sided fourth aortic arch, if it disappears, and instead of that, if the dorsal aorta, which normally disappears, it persists, then what will happen? The right subclavian artery will be formed by the right dorsal aorta, and that right dorsal aorta is attached to the descending thoracic aorta. Okay, it is attached to the descending thoracic aorta below the origin of the left subclavian artery. Now, another thing I have just forgotten to tell you, that this left subclavian artery, it arises as the seventh intersegmental artery, but due to elongation and due to that head folding and due to many other things, this left subclavian artery, it is migrated, its origin will be shifted towards the left common carotid artery, Here you can see that the left subclavian artery, it was arising first from this area, that is at the end of the arch of the aorta, but because of this lengthening of this neck, all these factors, this left subclavian artery, its origin will be shifted towards the left common carotid artery. That is another changes occur. Now here again we come to this one. So here you can see that the right subclavian artery, it is taking origin from the aorta distal to the left subclavian artery. And in that case, the right subclavian artery, because it is present on the left side, it has to go to the right side to supply the right limb. So it will go behind the esophagus and the trachea. And then it enters into the right limb. In that case, the esophagus may be constricted or may not be constricted also. Okay, compression to the esophagus and trachea may also occur in case of if that right subclavian artery is formed from the right dorsal aorta. Now sometimes both the fourth aortic arch, they persist. On the left side, though, it is normal, but on the right side, if it persists, if the right dorsal aorta also persists, then it will form the right aortic arch. It will form another aortic arch, and that aortic arch, they are the aorta, that is the esophagus and the thoracic duct, they will be here. So they are compressed between the two aortic arches. Between the two aortic arches, the esophagus and the trachea will be compressed. Okay, so that is the double aortic arch. Another is interrupted aortic arch. Here you cannot see the left aortic arch. So left aortic arch disappears. Dorsal aorta, this is dorsal aorta, which is connected with the sixth aortic arch. By this is the pulmonary trunk, and this is the sixth aortic arch on the left side, which form the ductus arteriosus, but on the left side, the left fourth aortic arch disappears. So if that left fourth aortic arch disappears, then the right aortic arch will be there. The aortic arch will be there, not the right side, but the aortic arch will be there because it is formed from the aortic sac also, and also by its left horn. But the rest of the arch of the aorta on the left side, it is absent. It is a very, very rare condition, and if it happens, then surgery is needed. In that case, the aorta and the dorsal aorta, they will be connected with each other, and the ductus arteriosus will be closed. Okay, so that is a very rare condition and very serious condition also. Then another is the right aortic arch. When the right side, that aortic arch is present, on the left side the aortic arch is left fourth aortic arch disappear, right fourth aortic arch is present, then on the right sided the aortic arch is formed, and it runs in front of the right bronchus, like that left aortic arch which runs in front of the left bronchus, that is here it will runs in front of the right bronchus, and there will be the ductus arteriosus will be present, the ductus arteriosus will be present, which passes behind the esophagus and the trachea and may compress this one. Okay, may compress these two structure, that is the esophagus and the aorta. So these are some abnormal development of the aortic arches. So I think my lecture is over, and if you have any question, if you have any doubt, please ask me. Then I have given one assignment here, that is name the derivatives of the aortic sac, means what structures are formed from the aortic sac, from its right horn, left horn, and also what are the derivatives of the aortic arches, from the first to sixth aortic arches. Okay, so you write the derivatives of the aortic arches. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you.